Hi, I'm Emily, work group 23, and this week we're back to discuss the role of predictive analytics in the medical and clinical care field. Predictive analytics helps make clinical decisions through the use of electronic algorithms that help predict future events in real time. This prediction of events that may occur in the near future may help clinicians make better decisions for patients. There's a wide range for the use of this application, such as using it for decisions on ICU level care, risk of post-operative complications, and many more. On the flip side, there are also risks of misusing predictive analytics. The results of predictive analytics may compromise with ethical and professional obligations physicians have in regard to helping a patient decide on the best treatment plan and representing the patient's best interests and care. The model used with predictive analytics may cause many conflicts of interest due to differences with the set model and the individual patient's preferences. This will lead to complications for the physician's obligations. Predictive analytics is still growing, and many questions are still left unanswered. Will the future of health lie solely in the hands of predictive analytics, or just be used as a supplement for a physician's clinical decisions where the physicians continue to advocate for the patient's best interest?
Hi, this is Marina, and I'll be discussing the benefits of using predictive analytics when opening a new healthcare facility. First, selecting the right hospital and clinic sites. Opening a new healthcare facility is an expensive investment. Predictive analytics can help you evaluate size by forecasting potential visits, measuring the impact of new facility opening on existing facilities, and avoiding the expensive mistakes. Second, optimizing staffing levels and improving facility operations. This answers the questions of how many staff members should you plan to have on your own new healthcare facility. By using the visits forecast generated by predictive analytics model, you can determine the volume that the facility will likely handle and can optimize your staffing level accordingly. Third, identifying which households are most likely to respond to your marketing messages. Rather than blanketing a trade area with marketing messages for your healthcare facility, you can identify which households are most likely to respond to your message with a marketing solution that incorporates predictive analytics modeling. Lastly, supporting long-term strategic planning initiatives. Healthcare organizations use a variety of tools in the long-term strategic planning process and predictive analytics that are helpful resource that will arm your team with another source of insights to assist with important decisions.
There are things that we need to consider before integrating predictive analytics into healthcare, and one of those things is how it'll be integrated into the day-to-day. A 2019 study I found actually looked into this. They followed a few physicians and nurses and how they used and adapted predictive analytics in addition to pre-existing patient files. And it was found that they viewed it as another piece of the puzzle, like any other vital, because it was easily accessible alongside other patient information. And they also found that it led to more engagement when using predictive analytics, so that more blood workups and antibiotics were ordered for sepsis when using predictive analytics. This does give rise to concern, though, how healthcare professionals will get used to this data, how to utilize it. I think proper training will need to take place because it is a new piece of information and they will need to figure out and learn how to take this information and use it accordingly. On a related note, it's important for physicians to be able to think critically of predictive analytics before integration. They must be able to know enough about the stored algorithms in order to determine whether or not they take into account appropriate patient sample. Does that mean it reflects overall disparity, or does it take into account the population of the patients they're treating? They must take into consideration the model's recommendation versus the patient case to case. Does the recommendation predictive analytics make sufficient for the patient needs, or what is it different from their own recommendation? How would they go about that?
Predictive analysis has been in practice for a substantial amount of time. As an example, the largest example of predictive analysis is from retail. For example, Walmart in 2004 utilized its transaction data to recognize various buying habits during different points in time. Sale of Pop-Tarts and beer increased preceding a hurricane. Amazon also uses a similar practice where it will scan through your previous purchase history to recommend you more purchases to accommodate your previous purchase. In healthcare, the hope is that care can be more efficiently deployed. An example was when the University of Chicago Medical Center used predictive analytics to optimize operating room usage in order to decrease operating room bottleneck. Workflows, notifications, room handoffs, and other factors were calculated and returned to yield decreases of turnover time by 15 to 20%. I believe that the benefits provided from predictive analytics outweigh the drawbacks, and as long as new policy is made to accommodate new technology, the drawbacks should be minimized. For example, an amendment to the HIPAA could address many of the privacy concerns from predictive informatics. Thank you for watching.